Hi everybody, Sue here. Today I wanted to come share some tips about tips for better breath. I was a dental hygienist for over 30 years and I thought I'd come just share a little bit about what I know. So those of us in the dental profession like to say that we can diagnose that periodontal disease from across the room. If you've ever been around someone where you're like, whoa, like you know what I mean. But most of us don't have that drastic of a situation, but we could use a few tips for better breath. So first, some of the reasons for bad breath. We all know the obvious, we ate onions or garlic for dinner, or maybe forgot to brush your teeth in the morning, which I don't know how that happens, but anyways. So those are some of the obvious ones, but some of the not so obvious reasons for bad breath include dry mouth. Our saliva helps to keep our mouth clean as it washes away food debris in the first steps of digestion. But some people who might have chronic dry mouth, either from medications that they're taking or a side effect of the medication, or some people with salivary gland problems, that they're not functioning properly, they can have that kind of morning breath issue all day long. Not only can medications cause dry mouth, but they can break down in our body and release a chemical that can be carried on in our breath. Another thing that can cause bad breath are infections in your mouth. Tooth decay, gum disease, mouth sores, or other infections in your nose, sinuses, or your throat that can cause postnasal drip and that can cause bad breath. Other conditions such as acid reflux or diabetes can cause bad breath. So, what can you do about bad breath? Well, first of all, the obvious is to be sure you're brushing twice a day and flossing once a day. Now, I know that the biggest problem why people don't floss is they don't like it or they don't know how. So, I wanted to show you how to floss. So when you do floss, take a pretty longer, a piece longer than you think you might need. And I want you to wrap it around your middle fingers like this on each hand. And then you have your thumb and your first finger to hold it, and it's nice and tight and it's not slipping around. So then you can go up top that way or down on the bottom. But what I want to stress is that flossing is not just to snap in and out and remove pieces of food that get stuck in between your teeth. What we want to actually be doing is kind of wrapping it around in a C shape. So we want to rub up and down on the side of the tooth and then move the other way, rub up and down on the side of the tooth. We're removing plaque that's sticking to the sides of the teeth, but up below the gums. So we're actually going up and down, cleaning off the sides of the teeth when we floss, not just snapping in and out to remove particles. Floss. If you just can't get the hang of this, they do make floss handles where you can put the floss on a little stick, or you can buy those pre-made little picks. There's ways to floss if flossing like this is too difficult. Let's see, your tongue also harbors bacteria. So after we brush our teeth, it's important that we stick out your tongue and brush your tongue. If your gag reflex is too much that you can't do that, sometimes it's easier to use they actually make something called a tongue scraper to clean off your tongue, and it's easier. They're plastic and it's easier on my gag reflex for sure. But this toothbrush even has on the back side of it, this is an Oral-B, but it has little like bumps to use to scrape your tongue. So look in, the dental aisle for tongue scrapers. Make sure you're keeping your tongue clean too. Let's see. Okay, we all know this. Have regular dental checkups to help keep your teeth clean, get your cleanings. And by regular, I mean every 6 months or more often if your dentist recommends, not regular like every 5 years. Regular, no. Try to avoid dry mouth. This will help. Drink water, chew gum, or suck on hard candies. Sugarless, of course. I've seen many people substitute candy for cigarettes when they stop smoking, and they use sugary candies and end up with tooth decay. So make sure you're using sugarless. Be careful with mouthwashes that contain alcohol because those mouthwashes tend to dry out your mouth more. There are some products. This product in particular is a biotin. It has a toothpaste and a mouthwash just for people with dry mouth. There's probably other brands out there as well to keep things moist in there. So those are my tips for fighting bad breath. I hope you found them helpful, and thanks for watching.